Mr. Smith. I'm Ashley. I'm going to be your PT today, and I'm here just to take a look at the wound on your hip that you got about 2 weeks ago. I'm going to start off with some questions. Is that okay?
Yep.
So, have you had any other wounds in the past?
No.
Lately, have you been spending more than 20 minutes in the same position?
Yeah, I have.
Right. And I know you use a wheelchair sometimes for long distances. Is that wheelchair fitted towards you?
No, it's not.
Right. While you've been in the hospital, have you noticed if you slide down towards the end of the bed lately?
Sometimes it's it.
And are you having any pain with this wound?
No, not too much.
Okay. So now I'm just going to run through your medical history. You had cancer about 2 years ago, a hip fracture a few years ago. Recently you had pneumonia. You have congestive heart failure and compensated cardiomyopathy and hypertension. Does that sound right?
It does.
All right. So the cancer from the radiation and chemo can leave the immune system compromised because the inflammatory response is decreased, and it can impact blood cell function and slow down the healing process. And the recent episode of pneumonia, since his body was already fighting an infection, it could also be a little weaker now. And from the congestive heart failure and compensated cardiomyopathy, that basically is the heart isn't pumping and filling adequately, and so there's not enough blood and oxygen getting to the tissues. So this will also impede wound healing. And hypertension also causes decreased blood flow to the area and limits nutrition to the tissues. All right, now I'm just going to confirm the medications that you are taking. I have that you're taking Prozac, Lasix, Digoxin, Tylenol, and Percocet. Does that sound right?
Yes, it does.
Okay, so the Prozac is used to treat depression. There's no real adverse effects on healing. The Lasix is a diuretic, and that is probably used for his congestive heart failure. Some side effects include increased urination, diarrhea, weakness, and muscle cramps. The Digoxin is used to treat heart failure. This helps maintain regular heart rhythm by affecting the sodium-potassium levels. Some side effects can be headaches, and it can actually help promote wound healing because it stimulates collagen synthesis. The Tylenol is for pain, and some side effects could be stomach pain and headache. And this is actually good because it's preferred over NSAIDs, because NSAIDs have an effect on wound healing, but Tylenol does not. Percocet is a narcotic for pain. Side effects are stomach pain and excessive sweating. Opioids can cause hypotension and can slow blood flow to the arterioles, which can delay wound healing. And other side effects that these medicines all have in common are vomiting, nausea, loss of appetite, drowsiness, and dizziness. And for lifestyle habits, he enjoys watching and playing with his grandchildren, and while he's healing, it is advised that he offloads the tissue to avoid any further breakdown. So he might not be able to participate in these activities for a little while. For the systems review, I would check heart rate and blood pressure. They should be within normal limits because he is on medication to control that, but it is possible they could be slightly elevated. And then pulmonary, I'd want to take the resting respiratory rate and a pulse ox, and those also should be within normal limits. Musculoskeletal, he does have decreased function and mobility after the cancer treatment because he did report he's not as active anymore. Neuromuscular should be within normal limits. Gastrointestinal, his wife mentioned that there was a decrease in appetite, so I would want to get a MNA and a MUST just to make sure there's no malnutrition going on. And I would ask if he's having any bowel or bladder incontinence. Okay, so now I'm just going to do some tests and measures. I just want to make sure that there's good blood supply and her neurological exam would be normal. So I'm going to check your femoral pulses. Is that okay?
Yep.
All right. One from the other side. Good. Anything abnormal would be if it was absent, diminished, or bounding, and a normal grade would be a 2+. So now I'm going to check the dermatomes, and I just want you to tell me if there's any difference between sides when I do this.
Okay.
That feel the same?
Yep, no difference.
That feel the same?
Yep.
That feel the same?
Mm-hmm.
That feel the same?
Yep.
Any differences?
No.
Any differences?
No.
Okay, good. An abnormal result would be if there's any differences between sides. Okay, so for the wound exam, the location is on the left hip over the greater trochanter. And for measurements for length, it's about 4.8 for length. And then for the width, it's about 3.2. And so the total would be 15.4 centimeters squared. The wound bed, you can see red, pink, shiny tissue. So it is roughly about 80% of granulation tissue. And there is some whitish, yellowish tissue here and here. So I'd say that's about like 20% slough. And there is some undermining at 3 o'clock, so right around here. And for the edges, it is an even wound, and the color of the edges are a light pink, and they are rolled, and this is limiting migration of the keratinocytes. The peri-wound seems pretty normal from what I can tell. The type of exudate, there's a light pink drainage, so it would be serosanguinous, and the amount is minimal. The diagnosis of this wound is a stage 3 pressure ulcer. There is no visible tendon or bone that I can tell from this picture, but you can tell that there's full thickness skin loss. And the lateral hip is a common site for pressure injuries due to the bony prominence of the greater trochanter. So for treatment, I would do some debridement. I would do sharp selective debridement of the slaw because it's non-viable tissue. For dressing, I would want to use a dressing that's going to maintain the moist environment. Since there's only a minimum amount of exudate, I don't want a highly absorption dressing. So primary, I would want to pack the undermining that the wound has to fill in the dead space. So I could use a non-woven gauze as the primary dressing and packing. Secondary, I could use a hydrocolloid or a semi-permeable film such as Tegaderm. And the hydrocolloid is used for partial and full thickness wounds, and it also helps keep the wound moist. So that's why I'd want to use one of those. Securing the dressing, the adhesive from either the Tegaderm or the hydrocolloid would help secure the dressing in place. For patient education, I would want to educate him on offloading his left hip, so I would want him to avoid sidelining on the left until the wound has healed. And we would want to get him on a repositioning schedule to help prevent further pressure ulcers. He does use a wheelchair for long distances, so I would want to educate him on repositioning in his wheelchair every 10 to 15 minutes by either leaning forward, pushing yourself up in the air with your arms to really pressure on your low back, sacrum, and buttocks. He can also use a cushion while in the wheelchair because that just helps redistribute the load while sitting. And I want to educate him on signs that the wheelchair might not be fitted properly, so that way then he can take the means to go get it fitted. So sliding out of the chair, poor sitting tolerance, if the feet or thighs do not feel stable while in the chair, if he can't reach the ground, and if he can't use his hands effectively to propel. Some long-term challenges would be I would refer him to a psychologist for his management of depression, a dietitian to manage the decreased appetite that his wife reported. I would continue to be active with grandchildren, and when sitting or laying down, even when he is home, to reposition frequently to avoid reoccurrence of another injury. And he should do routine skin checks just because he is a lot less active after his cancer treatment. And from that cancer treatment, he is immunocompromised. So that could be a complication, and his other comorbidities has lead him to be less active. So I'd want to educate him on either going on walks and trying to get up more throughout the day.